People on HCBS waivers should not be in institutions. Some people with disabilities get long-term services and supports, or LTSS. LTSS are services that help disabled people live our everyday lives. Some examples of LTSS are job coaches, transportations, or an in-home helper. There are lots of different kinds of LTSS providers. Providers are people or groups who give people with disabilities long-term services and supports. Some people get LTSS in institutions, other people get LTSS in their community. When people get LTSS in their community, it's called Home and Community-Based Services, or HCBS.
Medicaid is the program that pays for LTSS in institutions and for HCBS. Medicaid is a healthcare program. The government pays for Medicaid. Medicaid has an institutional bias. Institutional bias means that Medicaid will automatically pay for LTSS in institutions. That means people in institutions get LTSS right away. But Medicaid won't automatically pay for HCBS in the community. Medicaid says people need an HCBS waiver to pay for HCBS. An HCBS waiver is a document. An HCBS waiver says you can get LTSS from places besides an institution. The HCBS waiver says you want to get HCBS instead of LTSS in an institution. And it says Medicaid will pay for the HCBS. If people don't have an HCBS waiver, Medicaid won't pay for HCBS. That means people who want HCBS may have to wait a long time to get HCBS. They may have to wait for years and years.
If you have an HCBS waiver, you should not be in an institution. The HCBS rule says that if you have an HCBS waiver, you should be living in the community. The HCBS rule is a rule the government made. The rule says what kinds of LTSS are and are not HCBS. The rule says people with disabilities have rights when we get HCBS and talks about what those rights are. It also talks about what providers have to do to respect our rights. Let's talk more about those rights and how to get them. There are some rights in the HCBS Settings Rule that you won't get right away because of the COVID-19 pandemic. COVID has made a lot of people really sick and unable to work. This means that HCBS providers can't find enough people to work for them. So the US government has given states some extra time to meet a couple of those rights, such as living in the community with people without disabilities, getting a job, having a private house, apartment, or room all to yourself, getting to choose your roommate if you have one, and living in a non-disability specific setting.
But states do have to tell the government when providers will be able to follow the HCBS rule. States have to have a plan for how providers will be able to eventually follow all the parts of the HCBS rule. These plans are called Corrective Action Plans, or CAPs. When you get these rights depends on your state's CAP. States must follow the timeline in their CAPs. The US government has said states have to give people all their rights within about 5 years. Most states shouldn't take longer than 1 to 2 years to give people all their rights, though. States might need more time to make or follow their transition plan. A transition plan is a plan for how the state will follow the HCBS rule. It has the following things in it: a plan to make sure providers keep following the HCBS rule, a plan to find out which providers don't follow the HCBS rule, a plan for what to do if the provider doesn't follow the HCBS rule, a way to figure out which providers can't follow the rule, and some people who are supposed to get HCBS are still in institutions. States need to figure out how to get these people real HCBS, but this depends on the state.
CAPs are for states that need more time before they can follow the HCBS rule. Here's a map of which states have CAPs and which states do not have CAPs. States in blue have CAPs. States in orange do not have CAPs. This might change in the future. Some states might realize they need more time to follow the rule. Some states that have caps might decide they don't need them anymore.